Hello, Miss Porter. How are you doing today?
Good, how about you?
I'm doing well, thank you. I want to thank you first for your time. I understand that you're extremely busy, and especially because you serve as a representative for California's 47th District and are also running for seat in Senate. So I'll try to make this quick. I myself am from San Diego County, neighboring your district in Orange County. I've seen that you've sponsored many acts that have served to advocate for better access to healthcare treatment, including the Women's Health Protection Act, which was used to improve access to abortion services, as well as other acts to improve access to mental health services. I'm grateful to be able to talk to you, and I hope that I may expand my knowledge to you. I wanted to meet with you in hopes that you can become a stakeholder in the issue of legalizing physician-assisted suicide. Do you know much about the topic?
No, I don't.
I currently work as a nurse advocate within the nonprofit organization Compassion and Choices. We advocate for patients and support their decisions when it comes to their end-of-life options. One of the things that our organization helps with is to support medical decisions about aid in dying. I wanted to talk to you more about our organization in hopes that we can help your constituents gain better access to these types of services. We partner with other organizations and leadership councils to address end-of-life care, empower others to support the decisions when it comes to end-of-life, and also defend medical aid in dying acts. We work alongside different leadership committees and councils who share interests to our cause, including a healthcare advisory, which includes medical professionals. I'm here more specifically to talk to you about physician-assisted suicide. It's already legalized here in California via the End-of-Life Option Act. However, we still have many restrictions when it comes to physician-assisted suicide, such as only allowing California residents to participate in the act. As a nurse working in the hospital, I've seen many patients with terminal illnesses who repeatedly get admitted into the hospital due to complications of their terminal illnesses. These same patients are already aware that they have a few months to live due to the progression of their illness and have already accepted their diagnosis. For example, Lauren, a woman from Arizona who was diagnosed with pancreatic cancer that has spread throughout her body. She must undergo the pain of her disease. She's still capable of making her own choices and has explored the option for physician-assisted suicide. She temporarily moved to San Diego to see her family if they can help better take care of her, but she's not an actual resident of California. Unfortunately, due to the restrictions of California's Aid in Dying Act, she cannot participate. Her state of Arizona does not have a law that legalizes physician-assisted suicide. She must instead continue her enrollment into a hospice program and continue to live and receive pain medications despite how debilitating it may be. Her other option would be to go to Oregon, where she may participate in physician-assisted suicide because they don't have resident restrictions. We respect the autonomy of these individuals like Lauren and hope that we can continue to advocate for others who are in a similar situation. We also want to make sure that we do not do harm to these individuals, including not allowing the prolongment of their suffering. We hope to change how we look at death and empower these individuals and allow them to make decisions that we believe can bring them a peaceful death. The criteria to participate in physician-assisted suicide is thorough in order to make sure that these individuals make an appropriate decision. Although California has already legalized their own act of physician-assisted suicide, we hope to expand the coverage within California as well as nationwide. California is one of 11 states that currently has legalized physician-assisted suicide. 4 more states have amendments on the table ready to be voted on. With your support, we hope to bring more light into the situation within Congress so that other decisions to legalize medical aid in dying can reach to other states.
Well, thank you for the information. My time is up here. Thank you for your time.
Thank you again for your time and hope that you can bring support for physician-assisted suicide in the future. Have a good day.